Good afternoon, all. What is SSTI?
Skin and soft tissue infection.
Skin and soft tissue infection. Okay, so skin and soft tissue infections. So these are infections which can caused by either direct penetration of the pathogen or by hematogenous spread of the pathogen from the initial site. So it can be caused by an externally from the penetration of the pathogen, or else the pathogen which is already inside in your blood. But by the hematological spread, it can cause the skin infections. So these skin infections can be caused by these microorganisms or the pathogens like Streptococcus pyogenes, Staphylococcus aureus bacteria, and Cyanobacterium minucitism. These are the some of the bacteria which I wrote, but so many bacteria are there to which will cause it's often skin and soft tissue infections. And like fungi, Candida species, Candida albicans, Candida tropicana, and all those, and parasites, Tinea, some other parasites also, and viruses, zooster viruses. So, which virus helps zooster can cause like infection? Zooster, herpes, and the symptoms of skin infections. Can anyone tell what are the skin? Okay, rashes, huh? Swelling, redness, heat. Okay. Next, itching. These are all externally. What you are telling. Internally also there, right? Not inflammation, bro. Sorry.
Fever.
Fever. Then.
WBC.
Okay. The symptoms of skin infections are swollen lymph nodes, and fever and chills, fatigue, irritability, and loss of appetite, nausea. These are the internal signs and symptoms of skin and soft tissue infection. Rashes, the itchiness or redness, swollen wounds. These are the external signs and symptoms of skin and soft tissue infection. Next, imagine this is a skin, your skin, okay? We have epidermis, dermis, superficial fascia, subcutaneous tissue, deep fascia, and muscle. Last muscle. This is the skin. So in this like layers, there are so many infections which is occurring. Okay. So in epidermis, you can see eryphilus, impetigo, folliculitis. These three infections can occur in the epidermis layer of the skin. And whereas edema, carbunculosis, and furunculosis can occur in dermis, whereas cellulitis, which will occur in the superficial fascia, and necrotizing fasciitis can occur in subcutaneous tissue, and in deep fascia it can occur myonecrosis. So these are the infections, layer by layer it can occur. Okay, so now coming into treatment part. So we have two treatment categories like non-purulent and purulent. So what is non-purulent and purulent? No. Pus is correct, but formation is wrong. See, purulent is the wound or infection which contains pus, and whereas non-purulent, it doesn't contain pus. Okay, so in non-purulent we have some infections like necrotizing infections, cellulitis, eryphilus. These infections it doesn't contain pus, whereas furuncle and carbuncle and abscess, these infection will contain the pus. So there is a separate treatment for those infection which contain the pus and doesn't contain the pus. So in this they are categorized into severe, moderate, and mild infections. So in mild infections we can give only oral treatment. We can give, okay, there is no requirement of IV. In oral treatment we can give penicillin, cephalosporins, dicloxacillin, and clindamycin. So these are the antibiotics. So sorry, this skin and soft tissue infection treatment guidelines only antibiotics, not any like corticosteroids or any applying topical agents for treatment. Okay, this is only antibiotics guidelines. And in the moderate infection, we will give IV treatment, whereas it contains penicillin, ceftriaxone, cefazolin, and clindamycin. In severe, we should do the emergent surgical. Like after the severe, the infection is very severe, we have to do the surgical removal of the wound or something like that, and inspection and debridement. Whereas and rule out the necrotizing process. We have to rule out whether the infection is going further, like after reaching to the epidermis, whether it's going to subcutaneous and causing any necrotizing like this. And empirical treatment we should start. So we should start with the vancomycin and piptaz. Why the vancomycin is used? Like vancomycin is an high grade antibiotics. Like we can use empiric treatment as this one only, na. We have treated all these antibiotics before severe. In the severe case, in the moderate case, sorry, mild case, in the moderate case, we have already treated with penicillin, cephalosporin. So vancomycin will be used when there is a methicillin resistance staphylococcus aureus, when the like bacteria which if it is resistance to all the antibiotics what you have given before, vancomycin will be used here. And vancomycin with clindamycin also will be used. And after culture sensitivity, after before we treat with the empirical, we will take culture for the culture, we will take swab for the culture, and then after culture sensitivity we have to give a defined treatment for that. What is that? So this is a monomicrobial. If the culture sensitivity shows only one bacteria or one pathogen, we have to give penicillin, clindamycin, and doxycycline and ceftazidime, and doxycycline and ciprofloxacin for a monomicrobial pathogens. Whereas if the culture shows any more number of pathogens, vancomycin and piptaz is a drug of choice. Now coming to the purulent infections, that is fungal, carbuncle, and abscess. Here also they have divided into mild, moderate, and severe. In mild, the same what we have followed there, penicillin, cephalosporins, and that is a treatment. Whereas in moderate, we'll take first incision and debridement, and then we'll send in every treatment we'll send for the culture sensitivity, and we'll do incision and debridement. And in and also we'll use empirical treatment as trimethoprim, sulfamethoxazole, and then doxycycline in purulent infections. And defined infections, if it is a methicillin resistant staphylococcus, we'll use trimethoprim, sulfamethoxazole. And what is MSSA?
Susceptible
Coccus aureus. For this, we'll use dicloxolin or cefalexin. And in a severe case, we will use vancomycin and dapsomycin, linezolid, tinavancin or ceftriaxone. And in a defined treatment, we'll use vancomycin plus piptaz for MRSA, and MMSA, nafcillin, cefazolin, and clindamycin. Thank you.